Welcome, and thank you for joining this educational review from Professor Mohammadi's teaching archives. In this presentation, we will discuss Bancaud's phenomenon, an important but sometimes misunderstood EEG finding related to abnormal posterior alpha reactivity. We will review what this phenomenon is, why it matters clinically, how it appears on EEG recordings, and how to distinguish it from several other EEG patterns that may appear similar during interpretation. Let us begin with the definition. Bancaud's phenomenon refers to the unilateral failure of the posterior dominant alpha rhythm to attenuate or block when the eyes are opened. Normally, in an awake, relaxed individual with eyes closed, the EEG demonstrates a posterior dominant alpha rhythm, usually between 8 and 13 hertz, maximal over the occipital regions. When the patient opens the eyes, this alpha rhythm normally decreases or disappears symmetrically on both sides. This response is called alpha blocking or alpha attenuation. In Bancaud's phenomenon, however, the alpha rhythm persists on one side despite eye opening, indicating abnormal reactivity. The key concept is that the abnormality involves reactivity, not necessarily the morphology of the alpha rhythm itself. Now let us discuss the clinical significance. This finding may indicate dysfunction involving the ipsilateral posterior cerebral hemisphere, particularly the occipital or parieto-occipital regions. It can be associated with structural lesions, disturbances of visual attentional networks, or other focal cerebral abnormalities. Because of this, Bancaud's phenomenon may serve as a useful lateralizing clue during EEG interpretation. Importantly, the findings should always be correlated with the clinical history, neurological examination, neuroimaging, and the presence or absence of additional EEG abnormalities, such as focal slowing. On the infographic, you can see a typical EEG example. With the eyes closed, both occipital regions demonstrate a symmetric posterior alpha rhythm. After eye opening, the alpha rhythm attenuates normally on one side but persists on the opposite side. This persistent alpha activity despite eye opening represents Bancaud's phenomenon. Again, the major abnormality is failure of normal alpha suppression. The infographic also summarizes the major EEG characteristics. The phenomenon is usually evaluated in the awake state during eye closure and eye opening. The rhythm involved is the posterior dominant alpha rhythm. The frequency is typically between 8 and 13 hertz. The maximal location is posterior or occipital. The abnormality is usually unilateral and may suggest ipsilateral posterior cerebral dysfunction. Several EEG patterns may resemble or be confused with Bancaud's phenomenon. The first is the normal posterior dominant alpha rhythm itself. In normal individuals, alpha attenuates symmetrically with eye opening. In Bancaud's phenomenon, attenuation fails on one side. Another related pattern is alpha asymmetry without loss of reactivity. Some individuals normally have asymmetric alpha amplitudes, but both sides still block appropriately when the eyes are opened. This differs from Bancaud's phenomenon, where reactivity is impaired. Mu rhythm may also create confusion. Mu rhythm is a central rhythm in the sensory-motor regions, usually between 8 and 13 hertz. Unlike posterior alpha, mu rhythm is blocked by movement or motor imagery rather than by eye opening. Its central location helps differentiate it from Bancaud's phenomenon. The infographic also compares Bancaud's phenomenon with rhythmic mid-temporal theta of drowsiness, or RMTD. RMTD is a benign temporal theta rhythm seen mainly during drowsiness. It occurs in the temporal regions, usually between 4 and 7 hertz, and is unrelated to eye opening. Unlike Bancaud's phenomenon, RMTD is a temporal theta pattern rather than an abnormality of posterior alpha reactivity. Wicket waves are another benign temporal variant. These are sharply contoured temporal waveforms often seen during drowsiness or light sleep. Although they may resemble epileptiform discharges, they lack evolution and are considered benign. Again, their temporal location and morphology distinguish them from Bancaud's phenomenon. Temporal intermittent rhythmic delta activity, or TIRDA, is different still. TIRDA consists of rhythmic temporal delta activity and is often associated with temporal lobe epilepsy. Unlike Bancaud's phenomenon, it involves slow delta frequencies rather than posterior alpha reactivity abnormalities. Finally, let us summarize the most important differentiating points. First, identify the rhythm involved. Bancaud's phenomenon involves posterior alpha activity. Second, determine the location. It is maximal in the occipital or posterior regions. Third, evaluate reactivity carefully. Normal alpha should attenuate with eye opening. Persistent unilateral alpha suggests Bancaud's phenomenon. Fourth, consider the clinical context and associated EEG findings. Correlation with imaging and neurological examination remains essential. In summary, Bancaud's phenomenon represents unilateral loss of normal posterior alpha blocking with eye opening. It is an abnormal EEG sign that may indicate ipsilateral posterior cerebral dysfunction and should not be confused with benign temporal EEG variants such as RMTD or Wicket waves. Correct recognition of this phenomenon improves EEG interpretation and helps avoid diagnostic misunderstanding. Thank you for listening.